Hi, I'm Katie, and this week on Aesthetic Authority, we're going to be talking with Dr. Vivian Bucay about her presentation at the Evolution of Aesthetics Conference by Aesthetics Biomedical. Hi, how are you, Dr. Bucay?
Doing great, Katie. How are you doing?
I'm doing well. So, I'd love to know a little bit about the presentation that you did at the conference about topical growth factor evolution.
Sure, my pleasure. Topical growth factors have been around for a really, really long time, right? And even though I think there's no doubt that they do exert some type of effect on the skin in terms of improving texture, skin tone, appearance of fine lines and wrinkles. But typically, the growth factors have been sourced from either conditioned media, from fibroblasts that secrete these growth factors. And there's different commercial preparations, but typically these cells are taken from a one-time donor, right? So the growth factors are not ones that the body itself has produced, but rather they have been cultured in the lab. The cells have been cultured in the lab, and then the growth factors obtained. And it's not just growth factors, right? I mean, there's pro-inflammatory mediators, there's anti-inflammatory cytokines. So there's lots and lots of things that are in this, if you want to call it like a soup. And so what's different about this next generation is with SoMe skincare is that it's really using the patient's own platelet-rich plasma, whether the patient comes in specifically for that, or it's part of another treatment. Let's say we're doing PRP injections for hair growth, or to be used after laser resurfacing to speed up healing. At this point, using that same PRP, it's now suspended in a serum that's been shown. This is what the real advance is. The real innovation is that this serum actually keeps the platelets stable for 90 days. So when I'm preparing it, it goes into a 1 month supply, so 3 different bottles, so that the patient can, store it and use one bottle at a time. But what was shown, and this was testing, in the lab, in terms of stability, is that these platelets remain viable, they remain intact. And why is that important? Because platelets contain granules, and these granules or alpha granules are the ones that actually have the growth factors in them. So the idea is that the growth factors are not just swimming around in a solution waiting to be used, and we don't know if they're going to be good or not. They're actually preserved within the platelets themselves, and it's not until they're applied to the skin and the warmth of the skin and the mechanical, application causes what is called degranulation or release of these alpha granules. And then the alpha granules secrete, they actually liberate the growth factors that then go to the targeted cells to then do a variety of functions, whether it's controlling pigment production, collagen secretion, decreasing inflammation. But in essence, everything that goes into wound healing, which is the model for skin rejuvenation. So that's what's different. That's what's different about this. Is that the source is really the patient's own biology, if you will. So it's not coming from anything else. So to me, that's kind of an ultimate, new level of personalized or individualized skincare, right? Because what's more individual than your own growth factors that way?
Definitely, definitely. And are you seeing, or do you, in your opinion, think that the more individualized and regenerative sort of medicine is really going to be the future in our specialty?
I really think so. I really do think that regenerative medicine, and I mean, we know that orthopedics have used it for injections for treating joint pain. We know that it's used in PRP is also being used in for chronic pain. I have several patients who've told me that PRP injections, instead of traditional injections of, let's say, steroids or anesthetics, that PRP has really helped them with chronic pain, for example, which was something new for me. But but in terms of skincare, I mean, we've been moving more and more toward that. And I think as it becomes easier to do and more accessible to healthcare providers, I think that is what the future is going to be. And I think patients will ask for it. At the end of the day, it doesn't matter what we offer. It also has to be driven by patient demand, right? Because I mean, it isn't just your pull this off the shelf and here, put this on your skincare. There's great skincare. I'm very passionate about cosmeceuticals and what's the latest and greatest technologies. But I think that if this becomes something that's easier to offer and is, the patient sees it as a good value and it's accessible, and it's also the provider sees it, the physician sees it as a good offering in the practice. I think it's going to be great. And it is also something that you can't buy. I mean, let's just call it what it is. It's not easy that you can't purchase your own personalized skincare on the internet, right? That's just not how that works. So in terms of why is it worth it in my practice, I know that it also creates touch points when somebody's going to come back in 3 months and do that. But at the end of the day, is it working or not? I was lucky enough at the perspectives meeting to get my own blood drawn and spun down, and the PRP added to my serum, and I've been using it. I am actually using it. I still believe in using topical antioxidants. I still use a retinol in the evenings, and of course sunscreen. But this is just adding something else to it, and it's super well tolerated. And that's the other thing is it's much becomes much more difficult to become allergic to your own PRP, right? So I think that's something that's really important too. But I'm a big fan of science, and not to make it sound cheesy or try, but as physicians, we are scientists also. And Zoe Dralos did quite a few studies. Has done quite a few studies. So on top of pilot studies, this was actually double-blind tested, vehicle controlled using the serum minus the PRP with serum and the PRP. And there was definitely improvement, and the study was carried for 12 weeks, if I'm not misquoting it, but it was no minimum, no less than 12 weeks, because that is the time that it takes to see collagen building, to really see changes in the skin. And it wasn't just one of these studies that, 9 out of 10 women agreed that it felt, good on their skin, or, they felt their skin more hydrated or something like that. This was actually objective data with measurements of smoothness, tactile roughness. What was to me probably the most impressive on the photos, on this, comparing the before and after photos, was the decrease in inflammation. Yes, there was improvement in fine lines and wrinkles on the forehead, around the eyes, but I was really impressed with the decrease in the appearance of this chronic redness, superficial blood vessels. And we know that that redness can come with chronic UVB exposure. It's not just always rosacea, right? I mean, people can call it rosacea, but long-term UV radiation to the skin does also produce that chronic redness, because there is an increase in something called vascular endothelial growth factor, which leads to more, increased blood vessels, size of them, diameter, superficial to more superficially located on the skin. So when we see that chronic redness, a lot of times that tells me there's been sun damage that way. So seeing that, and maybe it's this kind of balanced, growth factors that are in there. There's bringing down inflammation and causing the skin to just look healthier, more luminous, more hydrated. And yes, there's more evenness and pigmentation as well, less of that dyschromia, or the little brown spots, just that unevenness in pigmentation that we also see with chronic UV damage as well.
Yeah. And I was talking with Dr. Ava Shamban about the conference as well. And something that she brought up with me that you also mentioned just quickly is the two-part system of this conference, where it was trying the different products and then going into the conference presentations and hearing about the different modalities and what they can do. And how do you feel about that? Do you think that's the future of aesthetics?
I mean, that's fantastic when we can do that. I know for me, when I'm trying to bring a system into my office, if I'm going to bring a new device, a new technology, I have to try before I buy. And we can't always do that at some of these very large scale meetings, right? Because there's so many sessions going on. So one of the things I truly appreciated about this particular conference, besides getting to see, friends and colleagues that I hadn't seen in over a year, other than virtually, what I really, really enjoyed was this, there was this having access to, I tried the Vivace microneedling device. I have a Lutronic Genius in my office, but how was I ever going to get to see how they feel differently if it isn't without actually trying it?
Mhm.
So I did Vivace. I did it with no numbing. I mean, I know that they recommend some topical numbing. I'm allergic to it, but just the fact that I could do that. And then we had dinner later on that evening and my skin felt great, no downtime. What else did I get to try? I don't know, I got to talk with everybody. Oh, well, now as a follow-up, I just had the Wyco peel done, the one that is, distributed also by Plasma Pen. And so they did follow up and come to my office after this conference. And I always say, right, if you don't do something within a week or two after you go to a meeting, you're not probably going to, bring that in. So I did try it. I had the full face. It's like the unpeel peel. And so I know, and it's hard to believe that 33% trichloroacetic acid with hydrogen peroxide and kojic acid could just leave you looking refreshed, but without having any peeling.
Mhm.
And I would not have believed it, had I not experienced it myself on Wednesday. So today's Friday. It's been exactly 48 hours since I had treatment. I saw patients all day yesterday. Several commented, like, what are you doing under your eyes? They're so unbelievably smooth. And I said, well, I had this. So anyway, I placed my first order. So just the idea of going to a conference, getting to try things, and then hearing experts speak about it is pretty, pretty amazing. And the quality of the speakers were, I mean, I don't say it because Ava Shamban is a friend. I mean, she is a respected world authority on many things aesthetic and is always at the forefront in, doing clinical trials, research. But, I got to hear Michael Somanik also speak on things. I got to hear Shino Bay Aguilera do the keynote address. He was fabulous. And how neat to talk about mindfulness and start the conference out that way, not starting out with a new technology, but really just starting out on something that's so important and things that we forget to do in our daily lives. So I thought that was really neat. Vic Ross speaking about microneedling as well. So I don't want to leave anybody out. There were a lot of speakers, and of course, Dr. Grant Stevens was there, and I really liked it. So I liked the idea of scientific presentations, but also just conversational, just conversational interactions happening on stage, but to which we could all weigh in if we so wanted. So a small, intimate meeting to me is great. I think the challenge is how do you keep something, how do you keep good news from spreading?
The next question that I have for you is about the intimacy of the conference. Really, you were already talking about it, having these small intimate boutique conferences where you can really discuss the topics with other people and go in depth with them, because though we all love those giant conferences, we get to see all of our friends, we get to go to all of these different talks. Sometimes it is a little bit difficult to get your voice heard or have questions answered.
It really was great. I was talking, for example, with Dr. Somanek, and he's like, I had no idea that this existed. I've got to bring this in. How come I hadn't heard about it? I think because we're constantly flooded with so much information, any one of us at any given moment are probably receiving, dozens of emails with the latest, updates. And I want to read everything. But sometimes it's really hard just not only getting the news, the updates like Aesthetic Authority or, all the different things that we have, but we also got to keep up with our journals too. So so when that can be one-on-one or, five of us sitting at a table together and have that ability to discuss and actually really share our experiences and not be just, I mean, it really adds another layer, I think, of credibility and it makes me curious. I definitely want to try other things because I know that people that I respect are using this and talking about it on, as you said, on a kind of smaller level, more intimate level, and I can ask questions. I feel like this is the kind of meeting that is it's very valuable because there's a lot of information that's distilled. And what also I thought set this apart, that it wasn't just being spokesperson. If I were to give a concrete example, how is Somi skincare different from, let's say, Neocutis? Or how is it different from TNS essential serum? Or how is it different from just an epidermal growth factor serum? So these kinds of things, when you can then bring out the data and, compare it, I think that's really neat. And I think most people, like if you know me, if I get up and I'm talking about something, I will question. I may not always say what a sponsor, wants to hear. You want to open it up. To me, I feel like ABM basically did like a non-restricted educational grant in the sense that it was an opportunity to talk about different things, but they expected us to bring in our own real world experience
Mhm.
into this mix. So that's what I thought was really, great about it.
What happens when a patient comes in to the physician's office? What is the protocol that happens? Give me the kind of the nitty-gritty of what a patient who comes in asking for this does.
Perfect. I'll tell you exactly how it works. Let's say somebody comes in and says, you know what, I want to take advantage of growth factors, but either I don't want to use something derived from a one-time donation, or I'm really scared. What if it's somebody else's? What if I react to it? And I said, okay, well, let me tell you about SoMe, how this works. I want to make sure that they commit, that they understand that they are going to have blood drawn, just in case there's a little phobia there. And I said, it's just a really quick procedure. We're just going to we're going to draw your blood. And if it's tagged on to another procedure, easy peasy, right? I mean, it's just taking a little extra. It's very simple. It's going to take me 10 minutes or so to spin it down. I'm going to take out the platelet-rich plasma, and then it's going to go in sterilely into their each 3 separate bottles. This was prepared for me at the meeting. It has the date on it, even, which is really cool. And it has the lot number. So that's the other thing. So mine expires, well, now it's been made up. So it's got a 90-day shelf life, but had this not been used, it expires January 3rd, 2024. So it's another level of comfort for the physician who's offering this to their patients, that let's say somebody doesn't come in. I mean, this already has a 3-year shelf life before it's even used.
Mhm.
Okay, so that's really cool. So I have my label, and when the patient, I had to initial it to check it out, to, so it matched my blood. Cause I know people worry like, oh, what if they give me somebody else's, or how is that? So there is this very good level of checks and balances. Here is my SoMe. See, it's in this bottle. And the SoMe. And so and yeah, skincare, that's all you. And so there's just a serum in there, and then you only put 1 pump on your face. And so it's just, hang on, this is a new one. So, because I pulled it out nearby, it does have to be refrigerated once you have it.
Okay.
Okay, so now I have like a little pump of serum, and
Mhm.
that bit, let's not waste it. I'll just go stick it on my neck now, but it's enough to cover your entire face. No, just put that on my neck, and that's it. It's just like the first thing you put on after cleansing. So I show them what they're going to be, what they're going to be doing. And then they go home with a 3-month supply. And I tell them, like with any skincare, try it for 3 months, before you decide yay or nay. That way, this is, really pretty new. And I have to admit, I mean, it was slower to do this. This was, the demand wasn't as strong while we were shut down. A lot of shutdown last year, people not vaccinated, not wanting to, leave their home, et cetera. But now this is all ramping up. We're busier than we've ever been in terms of doing treatments. And I know that I'm with the majority of my colleagues, when I say that. So they get their skincare, and I explain to them that it will pair with others, but ABM, I believe, is going to do some further studies showing compatibility with other parts of the regimen, or whether even other parts of a regimen are even needed. Or is this really all you need? So stay tuned. There'll be more data to come with that. So with this, that's pretty much it. And then every 3 months they come in. I mean, they're probably going to be in the office 15, 20 minutes, and they're, in and out. What I think is really important, I had emailed Mary Ann Guerra about this a long time ago when I was first starting, because I was really worried about, what if a patient comes in, let's say it's a patient, I mean, I have patients who have HIV, it's well controlled,
Mhm.
or who've had, I mean, with all the things with Hep C these days, you would think nobody would have it anymore, but maybe there is somebody who's got a chronic viral thing.
Mhm.
This serum actually is, not only is it bactericidal, it's fungicidal and virucidal. So in other words, if your patient has something, and of course, we're observing all the universal precautions, but if that patient happens to have some type of virus in their blood, as soon as it goes into the serum, that virus will not live.
That is
So
very
it's pretty cool. It's pretty
yeah.
cool. It's infection free, and this was already tested in the lab. So that's part of this patented serum. So again, so as I explained to patients, your platelets are going to stay stable. There's not going to be infection in there. We're going to take that extra safety measure. Now that I ripped the label, you're going to sign out your lot number. You're going to initial it, and it's as controlled as if somebody came to my office. When I do a skin biopsy on somebody, I show them, this is your bottle. Before
Mhm.
they leave, I show them the label, matches your specimen. By the way, look inside and make sure there's a specimen in there, right? So we have that kind of like that pause, where you say pause, okay, yes, right arm. It's simple, it's safe, it's effective. I'm sure that SoMe is the first to do this. I'm sure there'll be others, but this is way different. I remember years ago being at a department store and they said, "Oh, we're going to send you your DNA, your own DNA cream, and you scrape your cheek, right, to take out buccal cells, put
Mm,
it in something and send it off, and then they send you a cream that was made just for you." I mean, really?
mm,
I mean, and who knew? So we know that here that the growth factors are there, they are bioavailable, and they are viable. The platelets are stable, they do not degranulate before they're actually applied to the skin. And keeping it refrigerated, it actually, like, I was scared, like, well, I don't want to get this done at the meeting because I'm going to be on an airplane for a few hours. What's going to happen if it's not refrigerated? You don't refrigerate it, and I mean, it's not, you can leave it out a few days without refrigerating it before you start using it, but once you start using it, then you do need to refrigerate it.
okay, that's good to
Okay.
know.
So, and they have little vanity fridges, because I know that walking from my bathroom to the kitchen to pull it out each time would be an extra excuse not to use it. So I actually keep a little fridge in my bathroom that was supplied to me. I know patients are more excited that they walk out with their little portable fridge and their skincare when they go home, and it's a cute little fridge. You can just keep it, in your vanity. Sure.
Those are all the questions that I had. I want to thank you for getting on this call with me and discussing your topics and going into detail for the Somi skincare. Um, I will let you get back to your day, but I just wanted to say that it was great talking with you.
Likewise, Katie, and I hope to see you at our next meeting in person.